Hello, I'm Susanna. I've got MS. I'll also be an MS reporter today, taking the lead on Dr. Ruth Dobson. And she will be talking about the risk of comorbidities in MS, and we'll have a little touch on diet as well. So I hope you enjoy it. So I'm going to ask you a few questions about your talk. So it was about comorbidities and MS, and especially related to obesity. Could you explain a bit more about that, please?
Yeah. So what we did in my work is that we looked at GP, so primary care data from East London, so from Hackney, Waltham Forest, Newham, and looked at factors that have been associated with MS. The difference is that in these boroughs in London, the population's relatively deprived, and 2/3 of the population are non-white. So we wanted to see whether these factors that have been associated with MS in white populations also have the same effect in non-white populations. What we found is that in non-white populations, or in the whole population, when we looked at obesity, there's no association between obesity and MS. When you look after MS diagnosis, actually people with MS are more likely to be underweight than they are to be overweight. However, when you look at the time of MS, this effect disappears, and actually people are most likely to be normal weight. When you then try and look at how weight changes over age using some mathematical modelling, you see that prior to diagnosis people are more likely to be overweight, and then during the subsequent years their weight appears to fall. We don't really know what's driving this or why this is happening, but it shows that it's an important area for research. The other thing that we showed is that both smoking and infectious mononucleosis, so glandular fever prior to MS onset, seem to have a stronger effect in non-white populations.
Okay, so the way I understand it is that, do you think that after diagnosis people change their habits to adapt to their new situation, so they're trying to be more healthy and thus they lose weight?
So I think there's a lot of possible reasons. So I think that's definitely one, and it's definitely one that in clinical practice we see. I see a lot of people who, as a result of being diagnosed with MS, have decided to make changes in their life. They've decided to stop smoking. They've decided to try and lose weight, eat more healthily. Also, I think there's probably something about, in the years leading up to your MS diagnosis or after you're diagnosed, you lose a bit of muscle mass. People who have been very keen runners may not run quite so far. And because we know that muscle weighs more than any other sort of part of the body, actually losing muscle weight can have quite a big effect on your overall weight, even though your body size may not change very much.
So this is quite interesting. I've never thought about that in this sense, because the thing you always hear is that obesity is part of a risk factor of having MS, and that clearly shows that it's not the case.
It's not quite that it's not the case, because probably it is a risk factor, but many years before MS. So I think one of the problems that we have with all these studies is trying to dissect out what happens many years before people get MS. So, the sort of cascade of events where MS might be caused can start maybe in childhood, maybe in teenagerhood. It certainly starts well before people are diagnosed. So maybe obesity is important then, but actually once MS has become established, it's not so important in actually driving the disease forward, and the effects of the MS take over a bit more.